Established in 2009, the Rebecca D. Considine Research Institute, also known as the Research Institute, is the center of research and innovation at Akron Children's. Our mission is to advance pediatric healthcare through groundbreaking research that transforms the lives of infants, children, and adolescents.
When I think of, where I was in Pittsburgh or Boston, Baylor, Stanford, perennial powers when it comes to being able to do big-time translational research. Where we are different, and I think where we differentiate ourselves, is while they were building, again, really powerful basic science programs and NSF and NIH-funded work, we were building frictionless access to high-quality care close to home at an affordable price. That's what matters. We'll never stop funding and doing basic science research, but what's different about Akron Children's is we have the infrastructure that many of those historical research houses are now redesigning and reimagining, frankly, to look more like us.
The Research Institute is committed to education. We provide hands-on experience through the Immersion Leaders Program, the Summer Pediatric Research Scholars, and a variety of internship opportunities. We also support professional development with initiatives such as visiting professors, Resident and Fellows Day, and other events that promote innovation.
There's so much support at the Research Institute, whether it's from my peers, my leadership. They're always asking us what our goals are and where we want to see ourselves and how they can support us move through that process.
Recent years have seen several breakthroughs at the Research Institute. We grew our investigator community, increased patient engagement, expanded study volume, secured more grant funding, and accelerated contracting. This has fueled a stronger, faster, more impactful research enterprise.
Working in the Institutional Review Board, I do touch on almost every project that is happening at Akron Children's, and it's so exciting to see the innovation that our providers are coming up with, the collaborations we're having across the country, and then just knowing how much our patients are benefiting from the work. I really enjoy that.
The Research Institute collaborates with departments within Akron Children's to advance clinical knowledge and scientific discovery. We work closely with pulmonary medicine on essential cystic fibrosis research. These studies have supported groundbreaking therapies, contributing to the remarkable rise in life expectancy, now nearly 65 years for newborns in the U.S. The Research Institute also remains a key partner in a national cystic fibrosis clinical research network that receives competitive foundation funding. This support allows our center to play an active role in testing and developing new therapies that can change the future for patients.
So people with cystic fibrosis, since the advent of modulators, have been living much longer and much healthier lives, and I really wanted to be a part of that. They're choosing careers that they couldn't choose before. They're having families, they're having children.
The Adult and Pediatric Burn Institute's research program has expanded dramatically, launching 2 investigator-initiated studies unique to our burn center. These were made possible through Research Institute support and foundation grants. A senior scientist with the Research Institute has been awarded an NIH R01 grant for a multi-site study. The Research Institute supports this work through grant management, clinical research coordination, and data management, including REDCap systems for participant data and the Delphi process.
The most rewarding part is when the children get to ring the bell at the end of their treatment. There's a huge celebration, and it just means they finished their chemo treatment, they beat cancer, and it's time for them to move on with their lives.
At Akron Children's, we will continue to innovate, collaborate, and push science forward as we remain true to the promise at the heart of everything we do, to treat every child as we would our own.